When I first tried the cannabis oil, it was 17 years after I had started my cancer treatment. So I had started out my cancer treatment with hundreds of thousands of tumors in my lungs and lots of other tumors wrapped around my trachea. And after my surgery and all my radiation, what I had left was 1 to 2,000, 1 to 2 mil sized tumors in my lungs and three larger masses wrapped around my trachea. And I took cannabis oil for about 6 weeks. I was taking really huge doses. I was taking close to 6 grams of oil a day. But I wasn't mixing it with fat per se. Although I did like to take it with a hot cocoa a lot of times. And it completely eliminated all of my cancer. But we've seen some pretty exciting cases happen with other patients as well. The very first patient that we treated from the palliative care unit was a lady who had stage 4 colon cancer with metastases in her lungs. And she was on 80 milligrams of morphine a day and 120 milligrams of Oxycontin a day. And the doctor told me not to freak out when she died because this was a hospice case and she only had about 2 weeks left. But we decided to try cannabis oil anyway. And we got her completely off of her morphine in the first month, and he removed her colon. She also had diabetes, and in the second month her diabetes was suddenly controlled, and she no longer needed to take any insulin shots. In the third month, we eliminated what was left of the metastases in her lungs, and what else? Oh yeah, and we got her down to 40 milligrams of Oxycontin, and that's where she stayed until 5 years later. I talked to her grower, and he told me, yeah, she's out of her wheelchair, lost 80 pounds, and doesn't take morphine, only takes Oxycontin, 40 milligrams a day. And she had to be like 84 at that point. So, you never know. Another patient we knew, she had all kinds of cancer, and the most aggressive was a glioblastoma, and she had a doctor give her an anti-seizure medication that actually gave her seizures and put her into the hospital. And while she was there, she continued to use her cannabis oil. And she was our very first Budwig patient. And they gave her a Budwig enema. Well, not they. She had a friend who was a doctor who gave her the Budwig enema in the hospital. And she got very, very stoned. And at that point, she was taking 3 grams of cannabis oil orally and not feeling anything psychoactively. So when she did the enema and finally got stoned, we were like, oh, well, there, we're finally penetrating the blood-brain barrier. And her doctor called me very upset. He was going to have my license to practice medicine removed. And I laughed because I don't have one. And I said, look, if you've told this patient she only has 5 days to live, and if she wants to use cannabis oil, perhaps you should allow her to do so and monitor the case very closely. So he did. And he gave her a scan that day and monitored the case, and the next day he scanned her again, and her brain tumor, her glioblastoma, had shrunk a full centimeter. That's pretty aggressive. And that continued to happen every day until he let her out of the hospital. And the brain tumor was gone at that point. I had another patient, had a lady with a very aggressive cervical cancer, and she was our first suppository patient. And within 6.5 hours of her inserting her first suppository, she started having large chunks of her tumor evacuating. So we've seen this work really very, very quickly.